every day at 12:30, or well, every weekday rather, at 12:30 to talk about your health, exercise, mindset, nutrition, and recovery. Your health is the #1 resource that you have in this life, so you want to take care of this. You want to be educated around this. You don't get to outsource your health to anybody else. You got to take full responsibility for it. Today, we're doing a kind of interview style here with Joe Nelson. Joe has a physical therapy clinic called Team Iowa. It's in the area, it's local, and he just started it up this year. And so we're going to talk a little bit back and forth about how strength and conditioning and physical therapy can synergistically work together. Because I don't know about your experience, but like in my experience, most PTs want to kind of hate on the personal trainer, strength coach, and be like, no, you should not be going and doing that. And most strength and conditioning coaches and most personal trainers are like, no, the physical therapist is stupid. And it's like a clash instead of a synergistic, like where people can kind of cohesively be, yeah, I went full synergy, but can kind of cohesively working together for the well-being of the person, the patient or the client, whatever you want to go call it.
Absolutely, and I actually work with a lot of people who have a personal trainer or a strength coach. My clientele ranges from young, 8 years old and up, all the way to people in their 90s that are staying active.
Yeah.
And so,
which is the way it should be. Like, I mean,
totally.
It's just how it ends up working out. Like everybody gets bumps and bruises.
Absolutely.
Yeah.
And so, what I end up seeing a lot of is, like you said, people that will go to their strength coach and not realize the importance of the strength coach and the physical therapist working together at the same time. Because what ends up happening is, in the end, you're going to see your strength coach a lot more often than you see your physical therapist. So if your physical therapist and your strength coach aren't talking, you're not going to get a benefit from either.
And if this physical therapist isn't, like, and not only if they're not talking, but like the exercises that are prescribed from the physical therapist, in my mind, this is in my opinion, the exercises that are prescribed by the physical therapist should be known by the strength coach, and the strength coach should be addressing those during the program and during the warm-up, and
absolutely,
and keeping them accountable to those exercises. I mean, like, you're just magnifying everything that the physical therapist is able to do.
I completely agree. And I actually work with a lot of people that I talk personally to their strength coach.
Yeah.
And it helps so much because what you tend to realize is you're actually on the same page.
Totally.
But what happens is, because they don't talk, you feel like you're fighting against each other. I think is in general. So I make a really strong point to be able to make a phone call and say, hey, Adam, I'm working with JD. And it looks like he's having
a hypothetical JD.
And we'll say, hey, look, he's struggling with his knee. Let's integrate these warm-up exercises in. And you'll say, great, that would be fantastic. That's one less thing that I have to think about now, because he's paying money to see you. So we want to work together on this, because now he's getting max benefit out of it. And if you're coming to a strength trainer a couple times a week or a few days a week, you want to integrate those exercises in. So it makes a lot of sense.
Yeah, it just makes really good sense.
It really does.
By the way, guys, if you do have a bumper bruise and you're watching this and you're going to a physical therapist, there is something that you have to do first. You do have to address your physical therapist or your doctor, your surgeon, whatever it is, and you have to ask for a HIPAA release form, because you have to sign off on them being able to talk to you. Like if we talk about a John Doe,
JD, John Doe.
Yeah, exactly. Then it's just a hypothetical. But if you go and you sign a HIPAA form, then Joe can talk to me and say exactly what he's seeing, and then I can tell him exactly what I'm seeing, because it's two different scopes. Like, not only like scopes as in like your expertise and my expertise, but also the what you can work on and what I can work on are two very different things.
Absolutely.
You know, like the Venn diagram. Where do you draw that line, by the way? Where do you personally draw it? Because everybody's just a little bit different.
Regarding what?
Like, where do you draw the line between this is appropriate for physical therapy and this is appropriate for strength and conditioning?
I tell everyone I'm not a strength and conditioning coach, and I think I know my expertise is diagnosing movement dysfunction. And I get max an hour with each person, and they're usually only coming a couple times a week.
Yeah.
2 or 3 times
That
a
would
week.
probably be a lot.
Yeah, and usually I'm only seeing them for a month or two out of the whole year.
Right. Well,
You know what I mean?
Yeah.
So until their injury is taken over, and they say, "Hey, look, I'm giving you these tools. Now you take them for the rest of your life, and I hope you never have to see me again."
Yeah.
You know, and that's kind of, and you can always come back if something flares up, come back, and we can reassess it.
Sure.
But I think where I draw the line is, number one, we spend a lot of time in my clinic with diagnostics. So my feeling is, number one, when you come and see me, you will understand what your movement dysfunction is and get a diagnosis. And I think if you don't get that diagnosis, you don't know what you're doing.
Yeah.
So drawing the line is, we spend a lot of time doing movement pattern, neural re-education.
Yeah.
And then you can't build strength in the time that you see me necessarily. True muscular gains are going to happen in the weight room. You can get neurologic gains by retraining your nervous system. Yep. You can get stronger by being able to do more bridges or being able to do planks for longer. But where you're going to see the real benefit is after those 2 months, hey, my knee feels great for the rest of my life. Let's go to that strength coach. And now let's be able to make those strength gains. So that's where I draw that line is it's really neural re-education in physical therapy in my mind. And then the strength gains and heavy lifting happen with you.
Yeah, I couldn't agree more. And like, I do think like most of our warm-up stuff, for instance, is most of that like kind of neural re-education stuff. Like you're just working on patterning out how the shoulder blade needs to move and glide on the rib cage. Yep. You know, if that's not happening, then we're begging for a shoulder injury anyway.
Absolutely.
Yeah, you know, or like simple stretches can be, you know, in a way, in effect, like a neural re-education pattern. You know, like if you're doing it right, if you're doing it wrong, you're teaching your body how to do something else. But yeah, I agree. Like for one, I think a lot of personal trainers and strength coaches try to diagnose people, and it's like, you don't get to do that.
Right.
That's just not a thing for you. Mm-hmm. Like, no, don't.
And it does take expertise, and it takes a lot of training and studying to be able to understand that diagnostics. Yeah. And there's a difference between a medical diagnosis and a movement diagnosis, because you can make the diagnosis of saying, hey, you've got a tight shoulder, and that's a movement diagnosis. Yeah. Or you've got a posterior rotator cuff strain. Yeah. So there's a difference between that.
I don't get to tell people like, yeah, you tore your labrum, or this is a slap lesion, or I get to tell them your back is really rigid.
Sure.
You know?
Sure.
And you do not have 70 degrees of flexion, and we need that 70 degrees. So let's go to work on getting you some abs.
Perfect. Yeah. That's exactly right. So,
like, I just get to talk in like lazy people terms, or lazy language.
So I'm a big proponent of re-educating that neural system so you move appropriately. Yeah. So I'm personally a certified manual therapist. So my bias is toward hands-on, manual, soft tissue work.
I could not agree more.
So my bias is every patient gets some type of hands-on treatment. So whether they need some type of soft tissue restriction worked out, whether they need some joint mobilizations, improving the ability to move, and then after you improve that ability with your hands or showing them how to move right, then they go in and they do drills in order to back that up. Yeah. And so after that, go to your strength trainer, build up the muscles around it, back it up with those warm-ups that you're moving appropriately with. Yeah. And then hopefully that lesion or pathology doesn't come back.
Yeah, I couldn't agree more. Like, I don't know. I run into physical therapists every once in a while that they refuse to put their hands on people, and they think, I'm just like, you're lazy, man. Like, I don't want to use the word pathetic when I'm with them, but I'm like, you're lazy. Like, that's the most ridiculous thing. Like, you don't care enough to be concerned about the well-being of the person that you're working with if that's the case.
Yeah, and I mean, a lot of the people that I see, because they've been moving wrong for so long, actually have a lot of soft tissue restrictions at the very least.
Yeah.
And what I see most commonly is, because of our society, how we're usually hunched over at a desk or on our computer, is thoracic mobility issues and hip mobility issues. Yeah. And you can fix a lot of low back pain without actually touching the low back. Right. With just improving your hip mobility and thoracic mobility, you'd be surprised how much better you feel in your low back.
It's hardly ever the point of pain that is the problem. In my experience and in like my studies, and stuff like that, it's like I can't tell you how many times people have called me a genius because did like a half butterfly stretch, or had them do a half butterfly stretch for like a minute on each side and one thoracic mobility drill, and they were like, oh, okay, now I feel better.
Yeah.
Like my back pain's gone away. I've had this back pain for 20 years, and now it's gone. And it's
Absolutely.
like, dude, like, I didn't do anything.
Yeah.
I just did like a couple really quick things that were super, super, super simple,
Yeah.
and they feel better. And we didn't even close to their spine.
That's exactly right. And here's what I'll tell my students, because I have a lot of students come in and observe and learn, and PT students that are at the physical therapy department here at Iowa City come in and watch me treat, is at the simplest level, whatever your point of pain or dysfunction is, think about trying to take stress off that area.
Yeah.
So how can you, easy example, how do you take stress off the low back? Because your low back is in charge of moving in extension and rotation and side bending. If you can improve the mobility around that joint so that joint now doesn't have to move as much, easy one, like when you're doing a baseball swing, is just an easy example, or a golf swing, even better, is if you're not able to rotate through your hips, you will rotate through your low back.
Yeah.
And if you make 100 swings, you are stressing out your low back 100 times in a row with a hard swing.
Yeah.
So by simply, like you said, improving that hip mobility, now you swing and you go, oh, my back doesn't take the brunt of that swing.
Yeah.
So you're exactly right.
Yeah.
It's usually not the area of pain that's causing the underlying root of the problem.
Yeah, hardly ever. And like if you think about how, like, for one, like each vertebrae between the low back, like it's designed to move like 1 to 2 degrees, hardly at all, right? Whereas like the thoracic up here, we're able to rotate a ton. So like if we're forcing rotation at the low back, too much of it, we're just asking for an injury. Not only that, but like this up here is pretty big. My hips, like everybody's hips and their upper back region are like big, muscly type areas. Your lower back is not. I mean, who do you think is going to win in that fight? Your lower back's going to get the shit kicked out of it. It's just not something that you want to fight with. Yeah. You want to create stability at that low back, and then you want to, like, usually most people could use more mobility through their hips and their upper back. But
Oh, absolutely.
yeah,
And
I
see
mean, every
that-
once in a while I'll see a hip where I'm just like, you have no stability at all. Like,
Yeah, that certainly happens. And I think the older you get, too, the stiffer you get generally. So basically, if I'm looking at someone with dysfunction, typically the older you are, the more years you have on your workouts sitting at a computer, I can almost guarantee you could benefit from some kind of mobility, flexibility exercise.
Yeah.
So, and then the younger you are, you're probably more likely to have a stability problem or an instability.
Right. Yeah.
So
that's kind of like that's where I think a strength coach job comes in. Is like, are we dealing with like there's a few different things that I'm checking off of. Like, is this a mobility case or is this a stability case at each joint? Like, I got to figure out what I'm working with where.
Totally.
And then if there's pain, I'm like, I don't get to touch that.
Sure.
You got a painful shoulder. I'm just like, nope, that's for Joe. I'm not touching that. I'm not touching your painful shoulder. That's
Sure.
That's for someone that's covered by insurance.
Sure. Yeah. And honestly, I mean, if it's someone who has been dedicated to things that you're doing at them, they're doing their warm-ups appropriately, they're working on their thoracic and hip mobility, they're working on their core stability, hip stability, and they're still having pain, that's where you really get the benefit from the manual therapy.
Yeah.
You really do.
Yep.
And that's that component, I think, that is the X factor, is get your hands in there. At the easiest level I can describe it, get in there and manipulate the tissue, get blood flow to it. We've got to, in order to get that to heal, you want to speed up the healing on it by getting blood flow to it and actually creating that healing process. It doesn't naturally happen on its own very quickly.
Right. Which, okay, so you talked about blood flow. So this is one of my big things. Like, when should people to return to exercise after they've been injured?
Good question. So I'm probably a little, as far as continuing exercise, I'm a big proponent, keep moving. So don't stop moving, because you're going to end up prolonging that injury for many reasons. Nutrition is going to go down the tubes once you stop working out. Your flexibility is going to go down. So you're actually doing yourself more harm if you completely stop everything.
Yeah.
You've got to do modifications instead. And we talked about this earlier.
Yep.
This is where, if you're working out with your strength coach and having a physical therapist, they have to talk. So you're exactly right. We talked about the effects, the crossover effect of if you have an injured knee, for instance, you want to work the contralateral or the other leg still.
Yep.
Because if you don't do that, you're going to end up, number one, your other leg is going to become noodly and weak.
Yeah.
And then number two, you do have that crossover.
Yeah, you sacrifice you sacrifice your good leg for your injured leg. It's like,
Yeah.
well, what's the point in that? Like,
Yeah.
keep working that leg.
Absolutely.
Like you get blood flow,
Yep.
you get the neurological effect, you still get your training stimulus.
Yeah.
Like
Totally.
you're still progressing.
Yep.
Like nothing stops motivation and progress like an injury, but it doesn't have to be.
Totally. And on top of that, if you are seeing a physical therapist or someone like Adam that knows different exercises you can do on that injured leg that's not going to cause you pain, do those exercises on your
Yeah.
own at home or at the gym. So if you can figure out some exercises by talking, and I would recommend talking to an expert, Adam or myself or whoever you use, and getting those exercises to use instead of going on the internet and looking at them
Yeah.
as well. Because there's a lot of things that I've seen, knee pain, let's just go with knee pain, we're talking about that,
Yeah.
that people come in and say, well, my knee's been bugging me, so I've been doing this exercise. And it's actually aggravating. So
Right.
for instance, an easy one is a straight leg raise. So for knee pain, a lot of people will come in and say, I've been doing the straight leg raise for 2 months. And they have this terrible hip flexor tendonitis now. Because they've been raising
Yeah.
their leg over and over, and instead of consulting you, say, hey, what do you think about this exercise? And
Right.
say, once in a while it's fine, but you should add in probably hip flexor stretch to balance that out.
Yeah.
So it's just using your resources, and a lot of people like myself and Adam, we will give you advice for free.
Yeah.
So
yeah, if you just email, like you can
Email,
write in the
call, or
comments
stop
below,
by.
like yeah, there's like 1,000 different, well, not 1,000, but there's Facebook Messenger, there's Snapchat, there's
Absolutely.
Instagram, there's email, there's phones, there's stopping in. You know, there's so many different ways you can contact. But
Yep.
yeah, like the one I see a lot is shoulders. Like people will be like, they'll be like, oh, it hurts really bad when I go like this, and I'm like, so how you been stretching it? And they're like, oh, I've been doing this stretch, and I'm like
Totally.
like, dude, like in my head, I'm like, you probably have a labral tear, and you're probably tearing, like you're probably just adding to the problem. Like
Yeah.
really when it comes to a lot of injuries, it's more about what you do not stretch than what you do stretch. So you like when you're scaling stuff out, like you really have to like, all right, what can't we touch? What can't we touch? You know, what can't, or touch maybe
Yeah.
is the wrong word, but what can't we deal with? What can't we work on? You know, and you get back to kind of like, what's the source? What might be the best
absolutely.
course of action here?
Exactly. And
A lot of times it's what you don't do
absolutely.
more
Yeah.
than what you do.
Yep. And to go back to getting advice, I make myself extremely readily available. I make it a point of pride to be able to talk to you fairly easily.
Yeah.
And so if you stop by the clinic, we offer free injury screens where it's no hassle, no
Yeah.
worries. You come in and we can
Yep.
diagnose your injury and say, hey, look, here's a couple things you can work on at home.
Yeah.
And so
We do the same thing here with the strategy session. Like
Perfect.
your first one's always free, and our strategy session is going to last a full hour. I mean, like we go through some really thorough stuff because we'll do the FMS plus we'll do a bunch of individual joint testing.
oh, that's great.
Yeah,
Yeah, that's awesome. So
or we'll do the SFMA if
sure, you want
it's
to get really
warranted.
in depth?
yeah,
Yeah.
Like somebody comes in and I'm like, you can't squat.
Yeah.
You're not squatting. Like, you know, it's like
Yeah.
I got to. SFMA is just FMS and FSMA are just I don't know what you call them, assessment protocols, screenings.
Yep, movement patterns.
Gives you a little bit of a window into how somebody moves. You're basically taking away biomechanical advantage and looking at how they move. You know, so we take away your ability to cheat and then ask you to move around, and you think you're on Candid Camera, but you're not.
Totally.
But so, like, what do you even got? Like, what? Like, you've learned beyond what most PTs end up learning, because this is one of the big things with both of our industries. Is people get out of school
Yep.
and they think that school taught them enough to go out in the real world and heal people and help people, right?
Sure.
When it didn't even get close. Like,
Sure.
it didn't even get a little bit close. Like, what key? Like, why do you keep progressing on?
Good question.
Like for me, like I have like an absurd conviction
Yeah.
to like other people's well-being and to like my integrity. So like to
Yeah.
me, like to keep pushing on because like I want to help a billion people in a positive way.
Yeah.
Yeah. So like, what's your big drive?
Yeah. Good question. And that's an excellent question because I've actually learned a lot about myself in the last 3-4 months since I opened my own practice. And what you learn about yourself is what keeps you coming in early to the clinic to study for upcoming patients,
Yeah.
to learn the newest stuff. And for me, it boils down to I just care a lot about my
right.
patients, and I want every single patient to have value when they come in the door, and when they leave, say, hey, that was worth my time.
Yeah.
That was really helpful. I enjoyed my experience.
That's it.
And this was a valuable experience. And in order to do that, you have to be, number one, you have to know your stuff. So in order to do that, you're taking continuing education courses constantly. You are going on and getting certifications. Even equally as importantly, honestly, getting on a reputable blog or someone that you trust, as easy as going on Twitter and saying, all right, I'm going to look up the latest research on a functional squat. Getting on and just looking at things. Yeah. So it's just constantly making yourself better.
Yeah.
But essentially when it boils down to it, I just really enjoy interacting with people.
Sure.
And making people's lives better. And a lot of it is for people, and we talked about this earlier, getting confidence in your body. And that's the psychological effect. So saying, I have a lot of people that will come in and say, I started this new exercise class. I haven't worked out in 10 years. I hurt my knee in high school, and now I've been working out for 2 days, and it really hurts. Giving them the confidence to say, okay, injuries typically take, soft tissue healing time scientifically takes 4 to 6 weeks minimum.
Yeah.
So
Minimum.
So give yourself that time, and don't get frustrated along the way if your knee continues to hurt.
Yeah.
And mentally preparing them,
it takes time.
And education. And so we take a lot of pride at my clinic in educating our patients. That's the most important portion. If you educate your people, and they understand why it is important to do their exercises, why it's important to come in and get their manual therapy, to improve soft tissue healing time, to speed up that timeline, they're going to buy in, and they're going to say, I'm going to take control of my own life now that my knee feels better, and I'm going to go work out. I'm going to change my life.
Yeah.
And that's where you see
they'll be
those,
better at that thing because they took that 4 to 6 weeks.
Absolutely. Yeah.
But if they only went 3 weeks and they only got so the proliferation phase is like it's like a scab. I hope you guys understand what I mean there. It's like a scab. Like after the scab peels off, you kind of have you can see your skin is there, but the skin's not super strong yet. That's where you are at about that 3 to 5 week phase. So if you go back and you jump into something right away, injury happens again. Then you feel good 5 weeks later, injury happens again. Then you feel good 5 weeks later, injury happens again. Pretty soon you got bad injury. And what he's saying is if you take it out past that 6 weeks and you really try to keep you do keep a good attitude throughout that whole time, and you know that you're working for something, all of a sudden now that you don't break that thing open when it just gets past the scab stage, you're actually stronger and better for it.
Yep. And that's where that expertise comes in as a clinician in my mind, is recognizing what lesion people have, because I see everything from a labral tear to tendonitis that's been going on for 5 years, tennis elbow,
you probably
Achilles
see it's been going on
tendonitis,
for 20 years.
plantar fasciitis.
Yeah.
And so with those people, it's a different timeline.
Yeah.
And so you have to mentally prepare them, say, you're not going to see much change in 2 weeks.
Yeah.
You just aren't. You've got to be committed on your own to do these exercises, to come in and get your manual therapy done, to strengthen the muscles that are imbalanced. In order for you to walk correctly, then you're going to put less stress on your foot. And that understanding will get them over that 4 to 6 week hump and say, okay, I'm putting in the time now. It's the same with strength. If you said, all right, we're going to reach your goals in 3 weeks, you're setting them up for failure.
That's a liar. If anybody tells you that, they're so full of shit. I know people like that, though, that 60-year-old woman walks in that's never done any strength training, no running, she hasn't been active her whole life, and she wants to go run a marathon, and she's got 12 weeks, and people will tell her, yeah, let's roll. You'll be able to do it. And it's like, dude, she probably can go and finish that marathon.
Right.
But you're giving her probably a stress fracture in her foot. You're probably giving her problems down the line with her knee. You are not asking for a good thing here by feeding her that line that, yep, we can do that. No, you can't.
Yep.
Well, you can. It's not going to go well.
Yeah, you're setting yourself up for failure. Yeah. And that's where it comes back to when we talk about that injury, is taking stress off the area that's injured. So if you get a stress fracture in your foot, most likely you're doing something in your gait, or you're walking, or you're running, where you're actually putting more weight on one foot versus the other. Yeah. And over time, that extra 10% weight on the left foot adds up.
Yeah.
And you break down that foot. So it's as simple as that, and saying, okay, and you need someone to assess that. So you can do the FMS, or you can just do a functional assessment on people like we do, and say, look at when you squat, you actually lean to the right a little bit. It's probably stressing out your hip or your foot. So let's correct that. And you can correct that, then you take them on to the treatment table and you say, all right, let's look at your internal rotation on your left hip. Oh, that's lacking. I'm not sure how well you're extending through your hip with your gait. And then you can kind of go from there. And that's kind of talking about advanced concepts. But that's kind of where you want to go with this, is not just assuming that an injury happens just because, but actually diving into it. And I think that's where that value comes in, is that understanding.
I think that's a really good point, is that like very few injuries happen out of trauma.
Yeah,
almost all of our injuries happen because of an accumulation of repetitions or time or whatever it is. Absolutely. Like, it's hardly ever trauma. Even if it is trauma, it's usually
the ones we see,
because it's like you finally reach critical mass and the straw broke the camel's back, but this time it's not the camel, it's your back.
Certainly in my population,
just one time, and all of a sudden, and you're done.
Absolutely, yeah. I mean, I completely agree. And I'm in an outpatient private practice setting, and more times than not, it's exactly that. It's either an accumulation or that I bent over to pick up my cell phone,
or
and now and now that pop happened, and I went to the emergency room, and then they come to me the next day.
And that sucks.
Yeah. So
that's
where the value of what we do is assess people before they get injured.
Yeah.
And so that's where that free injury screen comes in. Or at the gym, you take everyone through that screening. That's perfect because you identify injuries before they can happen, or potential injuries before they can happen, and that's that compensation.
That's why I did this versus, when I was going for physical therapy, I just got to a point where I was like, I hate this.
Right.
I hate putting little old ladies with knee and hip replacements in pain because I got to move them around. I hate it. And for two, it's just like, all I could think about was, if you had only come to me 20 years before this, if you'd only come to me 20 years before this, if you only came to me 20 years before this. So I'm like, what am I doing over here? Not saying you're wrong, but you are. Just kidding.
Sorry.
But I was like, I want to go and I want to help people out before they get there. I wanted to make a bigger impact up front, so to prevent the break later on.
And certainly I've noticed a huge shift in that paradigm in the last 5 years, even because of social media and the internet really talking about all the injuries that are happening in professional sports, specifically baseball. And so what I'm seeing is coaches being a lot more willing to put their kids through a preseason screen before the season starts.
That's fantastic.
Because you're seeing it more and more. Kids are getting hurt earlier and earlier because they're doing year-round activities in one sport specifically. The list goes on, but
Tommy John is... 10 years ago, 10 years ago, you would have never heard of anyone under the age of 20 years old getting Tommy John surgery. That would have been so taboo, like you just got laughed out of the stadium. There's 16-year-old kids.
Oh, yeah.
Like a high percentage of them, not like 1% of the baseball population. It's like, it's growing and growing and growing. And I can't tell you how many kids, I don't even assess that many baseball players anymore. And I can't tell you how many times there's considerable laxity in that ulnar collateral ligament. It's just what is going on here? Yeah. But if you think about it, they're playing 80 to 100 games a year. Mm-hmm. Back when you and I played, I don't know about you, but for me, it was if you played 30 games a year, that was a lot of games.
Sure.
That was a ton of games. These guys are playing, well over 3 times that amount.
Yeah, and I could go on and on about all the baseball. And
baseball's a rough one.
I really think there's been a great shift because of how really prominent people in the baseball world and in the medical community in general have banded together and said, all right, let's put a pitch count.
Oh, yeah.
Let's put a pitch count on these guys. Let's assess these guys for injury before the season starts. Yes. And it's been nice, and I tell people this all the time, is because of the amount of injuries that have happened in the last 10 years in baseball, I've been able to benefit from all the research that's come out of that.
Oh, yeah, it's cool.
And so you can read these research articles and say, okay, this guy tore his Tommy John ligament, his UCL, and what were the correlating factors along with that? And you can look in these research articles and say, well, before the season started, we noted that his lead hip was lacking internal rotation.
Yep.
His lead ankle dorsiflexion was poor. his thoracic rotation was poor, and those guys had a much higher percentage of tearing their elbow because now you can't move as efficiently and you're dragging your elbow through.
Yep.
And so that's just a simple example of how using that research and that kind of mobility versus stability example can take stress off your elbow, and now you can pitch more appropriately.
Yeah.
So yeah, there's definitely been a shift simply because it's become such a popular topic to talk about that coaches are more willing to say, okay, I'll talk to Joe a little bit about what can we do before the season starts in order to identify these things. So it's really been great, and I've been pleased with the medical community. And this
They
is
really jumped on it
nationwide.
pretty fast too.
They really
I
did.
mean, I mean, 15 years ago, nobody did. Nobody said like
No.
a few teams sat around and did pitch counts.
Yeah.
Like only if you had like a real psycho coach that was all about baseball. You know?
And there was no magic number necessarily.
Yeah, it was
back
like-
when I pitched either.
yeah.
100 was kind of that number,
Yeah.
but there was no scientific evidence behind that.
No, and if
So-
you got above 100, it was like, oh yeah, your arm's good and tough. You know, it's like, well, if you're in the third inning, that just means you suck.
Yeah.
You're
So
just not a very good pitcher.
that's a lot of pitches in 3 innings. Yeah.
I'm exagerating, obviously.
Is that what you had in high
Yep,
school?
yep, no.
35 pitches in an inning.
No, 35 pitches in an inning. No, I remember like when I figured out that I was a decent pitcher is when I was getting out of innings where I was averaging between 9 and 11 pitches an inning, and I was like, damn, I'm doing pretty well.
Yeah, that's efficient
But-
pitching.
But also, I had a really messed up shoulder because of all the stuff that we're talking about right now.
Sure,
So that's
yeah.
one of the reasons I know anything about this because
Yeah.
I've been so beat up.
Yeah, and I think
Self-inflicted.
because
didn't know what I was doing back then.
baseball's a really cool sport, and I can go on about it, and I don't want to waste everyone's time talking about baseball the whole time, but it's baseball season, and this is the thick of things, and I think it's worth saying, pitchers and fielders are throwing harder than they've ever thrown in the history
yeah.
of the world, and hitters are hitting it further than they've ever hit, and it's due to the new training regimens. The fact that coaches now know, okay, you can create more torque by having improved rotation, by having all the things we've talked about.
Yeah.
And so then they train them, whereas maybe when me and you were in high school,
there's
we were
no-
doing
yeah.
football strength training.
Yeah.
You know?
Yeah, you were just saying just in that sagittal plane. You were sagittal plane is just straightforward. So you're doing squats, deadlifts, cleans.
Yeah.
If you were doing deadlifts,
Yeah.
you were doing bench press. You were never doing rows.
So it's
you
become
know?
much more widely
It's-
accepted. It's a really great thing. It's a really great thing
it
for
definitely is.
for youth and for
And I think it's just going to keep getting better and better too.
absolutely. Absolutely.
Like I would still say it's not great, but
Sure.
I think it has the potential to become, especially in the baseball world, where things are so controlled. You get on a football field, it's pretty chaotic.
Sure.
Baseball game, there's a certain amount of surprise, but
Sure.
really it's controlled atmosphere, a lot like a weight room is.
Yeah, that's true. When you're on the mound, you're controlling your own movement. Yeah, no, I agree. It's been good, and it's easier now than ever for coaches to be able to access that information because of the internet.
Technology's so awesome.
Absolutely.
It's phenomenal. I mean, there's just the flood of information on the internet is just as bad as it is good because of all the bullshit that's out there. But at the same time, if you can weed through the nasty garbage,
Sure.
there's some really great,
Oh, there are.
fantastic
Yeah,
resources.
and if you, I was never a Twitter guy. I just got on Twitter this year, and you can spend 15 seconds on Twitter and learn a couple new movement pattern exercises just by following the right people.
Yeah.
So you're right. If you can sort through that
Yep.
and just say, "Oh, great, I'll use that one today." That seems
Yep.
like a really nice glute activation exercise.
Yeah. You gotta be a little careful with monkey see, monkey do, but at the same time,
Sure.
yeah, definitely.
Absolutely.
You're following,
It gives you ideas.
yeah.
It gets the juices flowing in
Right.
your mind and say, okay, I could tweak that for this patient because they've got a left knee issue. Let's load that in a certain way. So it's cool.
Yeah, it's
Yeah.
really cool. But, well, do you want to tell them how they can follow you on social media? Obviously, what's your handle?
Yeah, so-
you do
so-
Facebook, Instagram,
Yeah,
Twitter. Do
yep.
you do them all? Do you do Snapchat?
We do them all. Yeah. Well, not Snapchat. Not yet. I haven't gone into the,
Yeah.
that yet. But, so it's Team Iowa Physical Therapy. So Team Iowa PT is our Twitter handle.
That makes
And
sense.
Instagram should also be Team Iowa PT. And Facebook, if you go to our page, it's Team Iowa Physical Therapy. And we post content on there. We feature some of the athletes that sign those HIPAA forms that agree to talk about themselves on there. And as we progress, we're only a few months in. Hopefully, we can put out some more content for people to follow. So
Cool.
I appreciate it.
I'm glad you came on, but yeah, you guys make sure that if you are going to physical therapist, sign your HIPAA form, and so that physical therapist can basically do his due diligence and talk to your strength coach or your personal trainer. But all right, thanks for being here, man.
Yeah,
really appreciate
my
it.
pleasure. Thank you for having me.
All right, guys, we're actually speaking of continuing education. I'm going to be gone for about a week here on a continuing education deal, so we're not going to do the show Thursday or Friday. Sadly, I'm gonna miss 2 days. Can't believe that. Maybe I'll find a way to sneak away on Friday. But
Yeah.
Anyway, thanks for being here, guys. Really appreciate it. Thanks, Joe, for being here. Any questions you guys have, post them in the comments section below. And always, if you like this, if you hated it, whatever, please take the time to share it out. But thanks, guys. We'll see you soon.